Ana Delgado, intensive care consultant medicine from Hospital 12 de Octubre, Madrid, Spain. So I generally work with adult intensive care, and I am here in the pediatric course mainly because of the all children and also the adults, the cannulation of the percutaneous cannulation in ECMO in all children. I think it's essential because first, you don't have that many cases every day. So people, they need to get comfortable with different challenging scenarios, and also because we can learn from the mistakes that other people do, and then we can bring those mistakes to the simulation, and everybody learn from the mistakes of everybody. So it gives you more secure and a more comfortable feeling when you are going to approach in the next working days or in the following months or for all your working life, basically. I mean, we have put so many scenarios of risk, you know what I mean? For example, air going to the ECMO circuit, or how challenging it is to do a cannulation in a cardiac arrest, and how somebody that is doing the cannulation could get shock if you don't have a good communication with the medical team. So I think it's essential. Simulation in a technique that is a very invasive technique, and you need to do it properly, and you need to do it good. And actually, if you don't do it good, it can lead you to a lot of damage to the patient. You need to do it good. So yes, getting all these scenarios where you can see what the risk that you can take if you don't do things good, it will teach you a lot how to become a better doctor, perfusionist, ECMO nurse. So I think it's essential. Simulation is the first. Simulation, according to the guidelines, our ECMO transport guidelines, is the first step to learn how to cannulate ECMO, how to do a transport, how to do everything. And then from simulation, you get to real patient, in-house patients, and then when you get an animal work as well, and then from there you get to the challenging scenarios like cardiac arrest and ECMO, or transport in ECMO, which is more demanding. Yeah. Well, the ECMO system, the ECMO cannulas, well, in adults you do a lot of more percutaneous cannulation. So everything is according to the size of the patient, but all children, they is kind of very similar to the management of adults in ECMO. And yes, you have the vessels are bigger, you can introduce percutaneously in the echo, you can see it. I think it's, you need different techniques. For the neonates, you have more, you do more surgical approach of the insertion of the ECMO, and yeah. Mm-hmm. Amazing, yeah. Well, I think it's the best simulator that I've ever seen, and I have seen a few of them. But it's amazing because you are able to do so many different complications on the cannulation. So they simulate a clot, it simulates that you have air in the circuit, that you have a lot of problems to pass in the wire, whatever. So a lot of problems in cannulation, but it can lead you also to simulate different rhythms and actually have the view of the echo. I think it allows you Arlequin syndrome, so it has so many opportunities. I was impressed, and also the fact that you can produce scenarios with artificial intelligence. I was impressed. It gave me a really good impression. I think you guys are doing a good job, and basically I was impressed about so many possibilities that you can do and so many things that they look more real, because this is a very invasive technique, and doing the simulation is hard because it's too complicated to simulate some, and you guys did a good job. I can feel it. Yeah, like putting the scenarios, it was really interesting and really impressive. Yeah. Well, I don't have only one. I have a few of them, but in artificial intelligence that could do in 2 seconds, you have like a scenario, that's amazing. The fact that you can do the cannulation and it has like a difficult cannulation situation, it was good. Also, the fact that you can change the circuit for cannulation quite quickly, that was impressive, because in other simulations, we took more time, because definitely the system is a little bit different. But yeah, the fact that you can see the views of the echo, that was really good. Harlequin syndrome, that you create pressures in the aorta. It was a high fidelity simulation, and that's the highest fidelity I've seen so far in that area, in the ECMO environment, ECMO troubleshooting, and the fact that it connects to the ECMO machine beautiful, and it can definitely, you feel that what you're doing to the patient is having a repercussion in the machine, and on the other hand, and it's the first time that I have seen that so accomplished. Yeah. My experience of the past 2 days about the whole meeting, I think we did an amazing job. Each of us in different areas. So we did the cannulation. I did the percutaneous cannulation, but my colleagues, they did the preparing the back and going to the transfer to the CT, and my other colleagues did the movement from the aircraft, which is quite challenging, also to the ambulance, and also they did also the cannulation of the percutaneous cannulation to the baby. And I think overall, after these two days course, you get the impression that, I hope, and they already say in the feedback, our students, that they got an overall impression that they learn a lot about transport, different troubleshooting of ECMO, and also percutaneous cannulation. Yeah, I hope they feel more comfortable when they approach a difficult transport or a difficult cannulation. I think they learn a lot about retrieval, ECMO retrieval in the difference of air, ambulance, ground. They learn about percutaneous cannulation in different sizes, the baby, the adult, and they learn a lot about troubleshooting. And we also give them difficult scenarios, like ECPR, cardiac arrest scenario, or somebody that needs brain that has brain death and is a potential donor. So we put them in different scenarios that we hope it will help them to do a better management, not only in transport, also in ECMO, in general, ECMO in the unit. So I missed the first one, so for me it was the first one as well. It feels really good. I think for Euroelso, and for the EPSNIC, the creation of this course, it makes sense. They have a lot to learn from both societies doing this course, and the setting here was amazing. I think you guys have an impressive simulation center where we can try so many things, and you give us a lot of facilities. So definitely we are very happy, and I cannot compare with the previous year, but I can tell you that this went really good. And from that, we will try, of course, to learn from the scenarios and learn what the students they like, they prefer, they want, and then take it from there and try to do every year better. But this one was really, really good. I'm pretty impressive. For sure, I was impressed. Yeah, for me, it was a high fidelity simulation, and actually the fact that you guys are thinking about how you're going to change things continuously. No, I think you are thinking a lot in different scenarios and how can you improve all the mannequins, the devices that you have. I think it's impressive. Yeah, I think definitely I recommend to do it with you.